Welcome to another segment of Health Matters. Extended interviews with physicians, dietitians, and specialists from the University Medical Center. We use portions of these interviews on WVUA 23 News, and a podcast and web extra video of the entire interview is available to you online.
For this week's Health Matters, we are sitting down with Dr. Joy Bradley, an assistant professor of community medicine and population health in the College of Community Health Sciences. Today, we are going to talk about an international health elective in Vietnam and how it connects with the college. Thanks for joining us today, Dr. Bradley. So tell me a little bit about this course.
So this course was an opportunity for undergrad and master's level students at the University of Alabama to have an experiential learning opportunity, which basically means that, it's a reality or more hands-on learning opportunity for them to go and experience different outcomes of health as it relates to population health, and then reflect on what those outcomes mean in relationship to the coursework that we cover in the class.
And why is it located in Vietnam?
So it was really just based on an opportunity that I had to work with our honors college, and so they already had that established location selected, and so it was just an opportunity for us as a college to kind of partner with them and offer the International Health Elective.
So what do the students bring back with them from this experience?
So actually the students were able to put together an artifact from their coursework and their experiences to kind of meld them together. And so that artifact, we call it a zine. And so they created this zine around the 7 dimensions of health and wellness. And so they provided pictures, interview quotes, and just different, they incorporate other artifacts throughout their city tours that kind of embodied what these dimensions of wellness actually look like from the Vietnam culture.
Does this give any students perspective in what they're going in, or are they already chosen what they want to go in field-wise?
So that is very interesting. For one student in particular, he had never really heard about population health, and so this was an opportunity for him to kind of understand, the different constructs that go into population health. So even though he was a computer engineering major, he was able to kind of put a little bit more context in some of the future work that he'll be doing, in that field. And for another student, she will be entering into medical school next year. And so this was a very eye-opening experience for her and how she considers to see herself as a future physician.
Yeah, because I would assume that is wildly different from what you would do over here in a clinical study.
Absolutely, but also there were a lot of similarities within the Vietnam population and the United States, as well as just Alabama more specifically, especially as you mentioned, the rural spaces. Yeah. And so, those rural communities do have a lot of the similar challenges when it comes to access to care, when it comes to just understanding the different issues that as they relate to insurance coverage and things like that. And so it was really interesting for students to be able to make those connections and to see the implications for policy and how policy does play a big role in people's access.
Do you think this will help rural healthcare workforce demand?
I don't know. I think that, it does open students' eyes to the importance of providing, those spaces for rural citizens. So for our future medicine doctor out there, and she does happen to actually come from a more rural space. And so she, I think, is very interested in understanding how to kind of make sure that she brings that care to her community.
How is this also just such a unique experience for students?
It's just, again, there is not much that can be said for allowing students to have the real world application. And so the more that you can kind of get them out of the textbook and give them real world examples of how these things matter and how they see themselves in the world, I think that's really, really important.
And what do students need to know if they want to go on this program? What do they need to do?
So they need to actually look out for opportunities around any study abroad program, not just the one in Vietnam, but just look out for opportunities for study abroad programs, and understand that, they can use their tuition to pay for these experiences, which I think is a very unique opportunity.
Is there anything that I haven't asked that you would like to add?
I think overall it was just a very interesting, and I learned a lot myself from going on this trip. And so I think that I would recommend for all students to pursue some kind of study abroad opportunity to kind of expand the way that they view themselves in the world, and actually how they can see their contribution to the world as well.
What was your experience like over there?
So I was really, I think one of the biggest experiences for me is to just how our interactions with the healthcare system there. What I learned was that healthcare is extremely affordable, even if you don't have insurance coverage. So we did have a couple of students who did have to interact with the healthcare system. And so they had payments of maybe about $60, and that wasn't a copay, that was their entire treatment process. And so that was really eye-opening for me to see how affordable healthcare could be. And then I think another thing that I learned is just thinking about the dimensions of wellness, and thinking about like the connections between a person's spirituality or a person's access to care as it relates to their occupation. I think it's really important for us to kind of think outside the box and think about, it's also related kind of to social determinants of health, is, I really was able to kind of see those things interacted in a very different way.
So tell me a little bit about the differences you learned over there compared to the U.S. healthcare system.
So one thing that really stood out to me as a practitioner and researcher looking at healthcare access across the United States and in Alabama specifically was an experience that we had around language barriers. And so we had two specific incidents where we had to, again, interact with the healthcare system. In one incident, everything was provided, all of the students' information was provided to us in English, and English was primarily spoken between the provider and the patient, and so it was a very seamless process. And whereas in another instance, there was limited English speaking, and everything that we received, like the discharge paperwork and things like that, was not in English. And so that just gave us a greater sense of empathy for people who have limited English proficiency in Alabama, and knowing, how to embrace the resources that are available to kind of help with those language barrier issues and getting to those good health outcomes.
How does it become a challenge in those ways?
So it becomes a challenge because, it's really important for you to understand the medicines that you're going to be taking, the reasons why, you're experiencing these health issues. And it really relates back to your patient's ability to kind of follow those recommendations. And so you really want to make sure that there is some good communication going between the provider and the patient, so that, they can have those optimal health outcomes.
And is this study going to be going on again?
So that is to be determined whether or not we'll go back to Vietnam as a destination for study abroad. However, we do also have another study abroad opportunity for students to go to Ghana. And so again, I advise folks that are interested in study abroad opportunities as it relates to health to interact with our study abroad office here at University of Alabama.
Thanks for joining us today, Dr. Bradley.
Thanks for having me.